the fight against breast cancer, men and women battling for their lives may find themselves needing blood from donors. Sharing these benefits and ways to stay on top of your health is Jennifer Coleman, outpatient coordinator for Baptist Women's Health Center. Hey, Jennifer.
Hi,
How
Gina.
are you?
Great.
Good.
Thanks for having me.
Thank you. So tell me about this collaboration between Baptist and Vitalant.
Yes, during the month of October, we partnered with them to show the importance of blood donations, because in the city of Memphis, blood donations have gone down 50% over the past 6 years and are continuing to decline. So we felt that it was important, especially for cancer patients that might need transfusions. It saves lives, just like a mammogram.
Yeah, yeah. I wonder. So, do you think the pandemic played a role in that of the donors?
I would think so. I really do. I think people still are afraid to get out and that type thing, and it made the blood donations go down. And it, we're in critical need. The city is, and so it's very important to donate blood.
I didn't realize that donating blood was such a big deal when it comes to breast cancer. I don't know why I was thinking that it's more so for just, diabetes and other diseases. You don't think of breast cancer for that.
Right. I really think that I think it happens a lot maybe in just cancer patients needing transfusions and things like that, and they need it for all cancers. So that's about all I know that when I talk to them that it's really critical for all cancer patients to have that on hand, and I guess especially if you had a rare blood
type. Yes,
right,
yes.
Right.
Can a donor donate blood and kind of save it for a specific person?
I believe so. I think you can earmark it as well. I think you can earmark who you want it to, and I'm sure that they probably ask the family first if somebody does need blood.
Yeah. What's the key points for breast cancer prevention?
Well, I'm on my soapbox again of how early detection saves lives. And it's critical that women start getting their mammograms at the age of 40 and then annually after that. But there are exceptions to the rule.
Right. It's like if you have someone in your family with a certain type.
Right, exactly. So if it's the direct relative, like the mother, like when I was 41, my daughter starts at 31.
Yeah.
So they start earlier than the age of 40. Now you can get a baseline at 35, but then we want you to get them 40 and above. And one of the biggest things that I like to preach, you've got to know your family history. You
got to, because most times we find out something as it comes up.
Exactly.
And then you're trying to seek the answer for it. So what if you can't pay for the screenings? How can people get it free?
Well, no, we do. We have grant funds. We have a great program, Tennessee Breast and Cervical, which is a state-funded program. And if you're 250% of the poverty level, then you are able to get your mammograms and your pap smears as well. Obviously, we don't do the pap smear part.
Right, but that's all well care.
It all's all well care, but the beauty of Tennessee Breast and Cervical is if there is a breast cancer diagnosis, they automatically put you on Tennessee Medicaid. So all your treatment.
That's perfect. I love that. Now, I hadn't heard that. That's really good.
Yes, but we also, Women's Health Center does have other funds that can help with deductibles and other things, because we just want to make sure that we get the best care, that women get the best care that they need.
Absolutely, because we were talking about how breast cancer can easily bankrupt a family.
Oh, gosh,
it's just crazy what that cost is.
Yes, I mean, medical costs. So if you detect it early, then I'm 3 times. And
but isn't that funny? We talked about early, detecting it early all the time, but people still won't go out and do it.
No, they don't, and which is part of my get on my soapbox. But I will tell you that when we bring the mobile out, and especially if we go into disparaged areas, I've started using my African American survivors to go with me, because I promise you, those women are going to get on the mobile. They will hand walk them up there, and they can see. Look at them. They were detected early, and look, they're thriving.
Yeah.
So that's
a good connection.
Yeah, we really do have a great connection. My survivors are just wonderful in helping the women in Memphis get screened.
Absolutely. Thank you, Jennifer. I love that.
Okay.
Thank you. All right, Bluff City Life, be right back. That's good. That's good.